Hey St. Louis, I'm Dr. Fred Echols, Acting Director of Health for the City of St. Louis. As the COVID-19 vaccine arrives in the metro area, questions continue to be on residents' minds about vaccines, the vaccination process, and the holiday season. Adrian from zip code 63113 asks, how do vaccines work? Vaccines use bits and pieces of a virus or bacteria to activate or spark the human body's own protective immune responses so they do not cause the person to develop the disease of interest, such as flu or COVID-19. If a person does get infected with a virus or bacteria, the immune system can quickly prevent the infection from causing disease. If the person does get infected, they are more likely to have milder symptoms and have symptoms for a shorter period of time than they would if they did not get the vaccine. For SARS-CoV-2, antibodies bind to and block the protein on the virus's surface, preventing the virus from entering our cells and initiating COVID-19, the disease caused by SARS-CoV-2. Not everyone infected with SARS-CoV-2 develops severe illness and requires hospitalization. Some people do not develop symptoms after being infected, but they can still spread the virus to others. This is called asymptomatic infection. Most vaccines do not completely prevent infection, but do prevent the infection from spreading within the body and from causing disease. Many vaccines can also prevent transmission, potentially leading to herd immunity. This occurs when the unvaccinated people are protected from infection by the vaccinated people around them because they have reduced exposure to the virus. Rebecca from zip code 63120 asks, how is the process for approving a vaccine moving so quickly? Traditionally, it has taken many years to develop a vaccine, prove its safety and effectiveness, and produce the vaccine in sufficient quantities for public use. This timeline is shortened for SARS-CoV-2 vaccines in development. There are several ways this has been made possible. 1, some clinical trials have combined phases 1 and 2 to assess the safety and immune responses. 2, because of the high number of new cases of COVID-19 in many places, differences in disease risk between those who received the viral vaccine and those who received the placebo or comparison vaccine can be measured more quickly than in the absence of a pandemic. And 3, the United States government and others have heavily invested in building the manufacturing capacity to produce large numbers of vaccine doses before phase 3 trial findings are available. Typically, vaccine manufacturers wait until the phase 3 trial is completed and shows safety and efficacy before making such a large investment in manufacturing capacity. None of these factors contributing to the accelerated development of a vaccine for SARS-CoV-2 imply that safety, scientific or ethical integrity are compromised or that shortcuts have been made. Craig from zip code 63116 asks, how do we know if the vaccine is safe? A vaccine will not be distributed in Missouri until the FDA determines the vaccine is safe. It is important to know that vaccines go through more testing than any other pharmaceuticals. Before any vaccine is made available, it must go through rigorous development and testing. Manufacturing is critical. Every dose must consistently be high quality. Additionally, extensive testing and clinical trials is conducted to prove safety. First, small groups of people receive the trial vaccine. Next, a vaccine is given to people with particular characteristics such as age and physical health. Then, a vaccine is given to tens of thousands of people and tested for effectiveness and safety. After that, the data is reviewed by the Food and Drug Administration, or the FDA, which approves the vaccine, and by an independent board, CDC's Advisory Committee on Immunization Practices, also known as ACIP, which will make its recommendations for use. These bodies are the final safeguards for the public, ensuring any vaccine is both safe and effective. Denise from zip code 63125 asks, who will get the vaccine first? Great question. At first, there will not be enough doses available for everyone at once, so residents will get the vaccine in phases. The federal government has recommended that first doses of vaccine, or phase 1, go to people at highest risk for COVID-19, including healthcare workers, first responders, and residents and staff of congregate care settings, including nursing homes. The City of St. Louis places equity and justice as core principles of its recommendations, going further than national recommendations by prioritizing all COVID-facing healthcare workers, not only healthcare providers, but also healthcare, food service, and facility workers. Similarly, home health workers, including personal care attendants, are prioritized, recognizing their important role providing services to vulnerable individuals and the fact that they often reside in communities highly affected by COVID-19. The general public, those not falling into one of the higher risk categories, is not expected to be offered a vaccine until later in 2021. Donnie from zip code 63125 asks, where can I get more information about COVID-19 vaccines? To obtain additional information about COVID-19 vaccines, visit the City of St. Louis Department of Health's website at stlouis-mo.gov. The website has a frequently asked questions resource on vaccines, and the resource has links to frequently updated Centers for Disease Control and Prevention web pages on COVID-19 vaccination. Thank you so much for tuning in this week, and thank you to Adrian, Rebecca, Craig, Denise, and Donnie for submitting questions this week. Be sure to tune in next week for more critical public health information. I really want to hear from you, St. Louis. Please send your questions to health@stlouis-mo.gov. Questions will be answered in the order they are received. If I run out of time on air, your question will be answered by return email. Stay safe and be well.